So part of my work initially was to develop and help countries to develop these declarations. And now that the declarations have been adopted, to see that we have activities that create facilities for ethical debate in countries where it does not exist. Of course, it's problematic because, for example, you have many different cultures, you have many different languages, and people often do not like what the government has agreed to, and it will take patience. Because in our country it has taken 40 years for bioethics to develop in its present state. So also in other countries it will take time. But the first steps are set. Now the last question is, what is the purpose of bioethics? Why is it important anyway? And I think there are three, I would say the answer would be threefold. One is that we need protection. And if you look at the history of bioethics, there has been a long series of scandals. You say, well, people are very educated, they're not evil, but nonetheless, all the time there is a risk that something goes wrong. And it has gone wrong. Even with a very well educated and high standing profession as the medical profession. It has gone wrong. So there is an inherent tendency in the system to focus, for example, more on technology than on the person. If you are in hospital, you know what I mean. That there is a temptation for everybody to look at the data, the hardware, the monitors. While you feel bad, you feel not well treated, but nobody cares how you feel, they look at the blood samples and the monitors. There is also an inherent, that has nothing to do with bad will. Because if you ask the doctors, they know perfectly well what they should do. But there is a tendency, seduction by technology. There is also a tendency when you do medical research to focus on the results of the project and to neglect the interest of the subject. So medical doctors involved in research, many times they indeed use patients as objects for their research, not caring well for the patient as a subject. And that is probably one of the reasons why all the time, even when you have regulation, all the time there are examples, cases where things went wrong. And we have now an increasing bureaucracy of regulation trying to prevent this kind of bad events. But the major, of course, the major effort should be directed on the moral thinking of the persons themselves, because you can have as many regulations if you want, but they always need to be applied in practice, and if the person is not convinced that he should do it, it doesn't happen. Now what is also curious is that with the many cases and scandals that we had in our countries, now you see that there are also a lot of similar scandals in developing countries. So also the problems, now that we have a better bioethical infrastructure in our countries, you see that the problems are also outsourced to other countries. And they have scandals, and you can name them in many different countries. So the first thing that bioethics is doing is to protect us, to make us aware that we need to be treated as human beings, even if the system is not inclined to do that. That's why bioethics is arguing that people need to be aware of their rights, also their responsibilities, but their rights, that they cannot be involved in a research project without their consent, for example. So there is this tendency that bioethics makes us aware that we are citizens, that we are persons, and that even when we are in very horrible conditions, we still need to be respected as persons. The second purpose of bioethics, I would say, is that it is the expression of our identity. In a way, if you want to know who is a person, you start, in the end, you start talking about his or her values. The identity of a person is very closely related to the moral values a person has. And the bioethical debate reflects, in a way, the values of persons, the values of a society. In our societies, there is a lot of value attached to individual decision-making, personal autonomy. So bioethics in our countries expresses this value. It's always the person who needs to make decisions, and in the end it's he or her who is making the final decision. If you go to other countries, the values are different, and that makes bioethics also interesting, because the value can be more focused not on the individual but on the community or the family. And then you have a different concept, a different approach of bioethics. Bioethics is even expressed, it means to express national identity. If I look at my country, we are very proud on our policies concerning euthanasia and concerning drugs, because it expresses that our country is a tolerant country. Some people hate it and say, well, this is not tolerance, it's indifference, but for us it's a matter of national identity. In our embassies we have a special attaché concerned with the euthanasia debate and the drug policy debate in other countries, that it's not harming the perception of the country in other countries. They say, well, in Holland they do whatever they like, they follow no rules. No, it's not true. We say we want to indicate that we have a clearly defined, carefully designed euthanasia and drug policy. So it's a matter of national identity. Then thirdly, bioethics is also a means to, let's say, not to express our identity, but to show what we share. Because you say, well, if you express your identity, the emphasis is on the differences, what makes us differ from other persons, other cultures. So we use bioethics to articulate in what respect we are different. Bioethics often plays a role, for example, in political debate, to demarcate whether a person is conservative or liberal, which is also typical for our society, but if you go to other societies, it can be quite confusing. Because when I was in Saudi Arabia, the most conservative persons, they were in fact very much in favor of sophisticated genetic technologies. They want to use pre-implantation diagnosis, they had no problem with abortion, and they were in favor of that because it could solve the problems of consanguinity, which is quite high in Saudi Arabia, and which they base on the interpretation of the Quran. While the more liberal ethicists say, well, it has nothing to do with the Quran, it's just tradition, so we should be much more careful with the use of all these genetic technologies, and we should find a way to prevent it by prevent marriages among family members. So you say what is conservative and what is liberal in this respect is a little bit different. But it's used to articulate the differences. Now my last point is that bioethics is also used to articulate what we have in common, what kind of values we share. And that is exactly maybe the focus of the UNESCO approach. We say, well, beyond all the differences, beyond all our different positions and values, we should look into what we share. Maybe on some issues we will never agree. Abortion, euthanasia, we will possibly never ever agree. And maybe it's better, because that people have different opinions and different values also makes it interesting. It would be boring if everybody has the same moral values, and bioethics is the same everywhere. So there need to be differences, but the differences can only be overcome when we are aware that at least we share some values. You can only sit down and talk and discuss when you have some values in common. And those are exactly the values, I think, in bioethics that has now been identified in the UNESCO declarations. Because they say countries agree that you have these different principles, autonomy, solidarity. You still have to balance all the principles. The outcome is not given. But the starting point for the discussion is at least the same. And we should make clear that when we talk about some of these starting points, some of these principles, that we also have the same idea what they mean, how they can be used, how they can be applied to address problems. Because also medicine, and I started to talk about the internationalization of science, medicine is the same in all the countries. They have the same medication, the same diseases, the same diagnosis and treatment. Only the patients are different, but the approach of medicine is the same. So bioethics in a high measure, high level, is also similar concerning the basic principles.